vertical or compression. Okay. Yeah, much easier with her. She could be sitting. You can have her sitting or standing. Are you eating too?
Yes.
I'm like.
All right, I'm good.
Okay. If she chokes, it's her own fault. Okay. Everyone got my back.
Yep. Yeah.
Okay.
It's
So
being
just
recorded.
Gentle. So that's my disclaimer. Okay. So just a gentle force down.
Yikes.
Straight down. And
Okay.
is into the spine. Okay. So that's going to be for compression, cervical compression.
How long?
Just a couple seconds, just nice and easy, straight down, back up. It wasn't too hard, right? Okay. And then the other one would be grabbing behind the ears, under the occiput. Okay. You're not trying to like squeeze her head. I'm trying to lift up with my base of my hand, palm, and just gently lifting up. Okay.
What are you feeling for though?
This is a provocative test. This would either cause their symptoms or relieve them. Okay. Typically, this would cause their symptoms, and this would relieve them. So if there's some sort of compression on the nerves, compression might cause radicular symptoms in the arms. Traction would cause the radicular symptoms to come out of the arms.
So this was traction?
Distraction.
Okay.
Okay. Speeds test. Anyone know what the speeds test is testing for? How about what body part?
Yeah. Shoulder?
Shoulder. You know what it's testing for?
Well.
How fast they are. Yeah. Okay. So we're going to have their thumb up, okay, and we're going to have them resist, okay? So hold. And this is not a strength test. This is a test for reproduction of symptoms. So what muscle in the shoulder would this be activating?
Your biceps.
How about deeper? How about the long head of the biceps? If that's what you were going to say next, I think.
I said biceps.
Yeah. Oh, did you? Okay. So the long head of the biceps, this would activate, okay? And that would be pain with this test would be a positive sign for bicipital tendonitis or something with the biceps tendon involvement. Okay. What's next on the list? Supraspinatus. Thumb down. This is also called an empty can test. So not quite full horizontal abduction. We're going to have just a little bit forward, about 20-30 degrees off of horizontal. Thumb down and resist. Okay? And my hand, I wouldn't have my hand on. Okay. This is another one. We're looking for symptoms. Okay. This is activating the supraspinatus. Supraspinatus was involved. Maybe a tendinosis, impingement, a little tear or something like that. This would cause discomfort. Next. Impingement test. Internal rotation of the humerus. So not pronation of the forearm. We don't need to worry about that. And then we're going to abduct. Okay. And this would cause symptoms. So remember the picture of the subacromial area that I showed you? So this is going to close, rotating this in is going to close that surface up, and then this is going to jam the humerus up into that subacromial space. So whatever's in the way and irritated, that would cause a positive sign of impingement. Yep. Oh, you're just practicing. Hawking-Kennedy next.
Yep.
Hawking-Kennedy, abduction to about 90 flexion elbow, and we're just going to go into internal rotation. This is similar to what this was, just kind of opposite way. We do the internal rotation here first, the impingement. This one we do the abduction first and then the internal rotation. So that's another impingement test. What's next?
Test for distal biceps or shoulder fracture.
Test for distal bicep. So person supination and flexion. So hold that. Right, they would have either they wouldn't be able to do it or they would have pain with that. They would have a problem with the biceps. Right, because the biceps does flexion and supination. You can also add a supination component in, so you can have them, you can resist their supination, so they can be going into supination and flexion. So that would get the muscle even more. Elbow next. Medial epicondyle test. So medial epicondyle test. What do you think we would resist for that?
Towards your body. So, what are you asking?
Medial epicondylitis. What muscles are attached to that?
I would say your pec.
So pec's here.
Yeah, but as you're going, if you're trying to.
So it's these muscles here. So these muscles attach to the medial epicondyle and come here and they do the flexion of the wrist. And again, I'm standing next to her and behind her because I want you to be able to see. Typically, I would always be in front of a patient, okay? Because some of the stuff you could do bilaterally, but you know, just for ease to see. Resisted wrist flexion would be, I'm looking for not so much strength, we're always keeping that in mind, but I'm looking for her symptoms here, okay? Lateral epicondylitis or tennis elbow, the opposite, extension, okay? This would reproduce her symptoms here, the lateral epicondyle. There's another one, lift the third digit and resist. That could also reproduce the pain from the lateral epicondyle. There's two. Actually, and then there's a third one would be just go into relax, passive flexion. What's the next one?
Medial lateral stress test.
Okay, so we need medial and lateral. So if we're going to test the medial ligament, medial collateral ligament, we need to give it a valgus stress. So we're going to support on the lateral side of the arm, just next, and I'm giving a force this way with her forearm. Okay, so what I'm doing ultimately is opening up that space and stressing that ligament. Make sense?
You're giving it force like you're pulling it?
I'm pulling her wrist
Okay.
and pushing with my left hand. So I'm opening up that space. Opposite would be, let me do this one, varus, okay? So pretty much the same thing, but just opposite. Tenel is basically tapping over a nerve. It could be done in several spots of the body. When we're talking the upper extremity, we have a couple spots. So that where the ulnar nerve comes through there, you feel that zapping a little bit? Not too much. Okay. So if the ulnar nerve was irritated, they would get irritated with this. Or also the carpal tunnel. Median nerve is here. Okay. And another thing about, no, we'll just do those two. Next one, Finkelstein?
Balance.
Oh, Fallon. Put your hands up like this. Push them together. Okay. So we're gonna have her hold this for like a minute. We're pushing. Is that all the flexion you have in your wrist?
Oh, do you want me to do like that? Or?
No, like this. There,
Oh.
there you go.
Oh,
okay.
okay.
Okay, we're holding the hand, having her hold it for like a minute. So what's that doing to the carpal tunnel? Opposite. It's compressing it. Because that's here. We're going to compress it, and that's going to put pressure on the nerve and reproduce her symptoms. Whatever those symptoms may be. Could be numbness, tingling, could be pain, weakness, whatever her symptoms are. And then what? Finkelstein? Okay. Finkelstein, we're going to have them close their hand on their fist on their thumb, then we're gonna have them ulnar deviate. Okay, everyone do that now. Grab your thumb and ulnar deviate. It doesn't feel good on probably half of you, right? It does. It's kind of uncomfortable.
Is it supposed to like hurt like here?
Yeah.
Yeah.
So this is stressing the tendon. This is for tendonitis, tenosynovitis of the thumb. Okay, and I'll talk more about that when we do the
So if
hand
it
stuff.
hurts, does that mean we have tendon?
No,
Oh.
only if it reproduces your symptoms. If you do it and it hurts for no reason and you weren't complaining about it before, it's not a positive test.
Oh.
A special test